Hi, Binnie. Thanks so much for joining me this morning. How are you doing today?
I'm doing great, Emily. It's a beautiful day here in Iowa. Spring is finally on the way. I hope you're having the same kind of weather.
Definitely. It's very nice here. So thank you so much for joining me. I was hoping to learn a little bit more about the founding of the Partner in Sexual Violence Special Interest Group.
Sure. It was my first SIPTA meeting, and some of the states had all gotten RPE money, and we were starting to try to get together. And a few of us there said, we need to share ideas. And so we said, let's start a group. I think we'd started one of the first SIGs or special interest groups. We decided to call it the Partner in Sexual Violence SIG because some people were doing domestic violence prevention, others RPE. And there were a handful of people that come to mind that I remember at that first founding meeting: Billy Weiss and Nancy Bagnato from California, Beatrice Perez from Rhode Island. It was David Lee as well. And I know there were a few others, but it was really an exciting time. We had decided that our allies who all worked at the sexual assault coalitions had their own mechanism through the National Alliance to End Sexual Violence for policy, but we didn't. And we knew the safe states could be our best arm and help us lift up the issue within public health departments. So that's why we wanted to affiliate with safe states.
That makes a lot of sense. Thank you so much for sharing. I love that y'all wanted to kind of model what the others kind of in the field were doing, but bring that public health voice to it because, the language is a little bit different. And, the more people working together, the more we can accomplish. That's so cool.
Yeah.
So the group has clearly been around for quite a while now. Why do you think people keep coming back to it?
That's a really good question. And I'll say that I always tried to be part of the Safe States conferences, but because my specialty was violence prevention, I looked for those topics. And so a bunch of us kept getting those issues on the agenda. And so we could use it again. We got a lot from like the National Conferences on Sexual Assault, but we also really wanted the broader injury and violence prevention public health perspective. So we came together to get together with those allies. And I think over the years, we contributed a lot to safe states, helping them refine their policy position statements on violence against women, obviously proposing other presentations. One of the things that I do think we did, this is about 10 years ago, was we developed a set of core competencies for states that did primary prevention of sexual and partner violence. And those competencies really helped shape how state level practitioners could work because they really didn't exist at that level. I do know that those competencies are still being used in the state of California today, and hopefully other states have adopted them. These documents have been shared with safe states and they should be available on a webpage somewhere. So I think that's an important thing that we did. And I'll tell you, I was excited to be a part of a meeting last year after I'd been away for a few years. And it seems like you guys are doing some interesting stuff now. You've still got people coming that have been around a while. What are you excited about? What are things that you're looking forward to doing?
That is a great question. Yeah, we've been doing some really cool work. We have some really interesting partners that have come to join us. I know last year, one of the things that was really neat was that we kind of delved a little bit more into partner-inflicted brain injury because our previous co-chair, Peggy, was with the Brain Injury Alliance of Nebraska. And that was especially interesting to me because that's one of the other programs that I work on. And so it was nice to hear kind of what's going on there. And I really like that our group is pretty diverse. So there's people who are kind of in the RPE roles, but there's also some people in some new and different grants and even some hospital roles. And so kind of hearing how everything can work together, I think has been really interesting. And so I'm hoping that as we go forward, we'll be able to kind of collaborate a little bit more and focus on some of the shared risk and protective factors and the health equity pieces.
That's a good point. And the other thing that as you're talking, I was thinking about is as the coalitions have gotten more funding and then more of that goes to their community programs, I think that we in public health have offered them help and support for strategies more at that community level or higher levels than just the individual, because a lot of our communities were doing those. So your collaborations among broader professionals makes a lot of sense. to get more kind of impact of what you're trying to do in your state. So that's pretty cool.
Yeah, I think we really like it. And I think it's helpful to have all of the minds come together with the RPE focus being at the community level. That's something that's new for a lot of people doing the work, but that's not necessarily new in the public health world. So it's kind of cool to have, kind of both worlds come together. And one of those, when we come together, we could do more things. So.
Right, right. Well, I know that a lot of the resources and products that we developed in some of the last 10 years have been shared with Safe States. And I don't know if there's still a repository, but I assume there is a place that people can access those. So I think for us as Safe States to continue to share that with people in the field and continue to evolve with the lessons you're learning is really important. And I'm just tickled that things are still happening to this extent many years later after I started doing work.
We're definitely happy to keep all of the, the resources going and kind of keep in that like spirit of collaboration that you started in, because I think that it's really invaluable to be able to collaborate with people across the country doing similar things, especially because, there's only, one or two of us in each health department in each state. And so, getting ideas from other people who think differently than us is really important. And then being able to share some of those resources and just have a place to kind of bounce ideas off of each other and learn from each other is really important. So thank you so much for setting it up and, kind of creating this thing that we can all keep on learning with.
Well, again, it was not just me, it was a village, a community of people who had shared interests. But I do think that really the efforts through the Safe States SIG really helped to bring RPE into the public health fold, because in many states, the RPE programs are kind of in other divisions, and it kind of brought them into the whole injury and violence prevention field. And that's what we wanted to do, is find our partners. So again, I'm excited about your work. I'm really glad we had a chance to catch up and talk today, Emily. And I hope you continue to do good things.
Excellent. Thank you so much for taking a little bit of time to chat with me this morning. I hope you have a great rest of your day.
Thank you. Take care.
You too.